Dermatology is a unique and visual specialty. Dermatologists can often generate a differential diagnosis based on how the rash looks, which we call the morphology of the rash. The important first part is to figure out what are the primary and secondary lesions. Other morphologic characteristics of a rash include location, number of lesions, demarcation, color, configuration, shape, and distribution of the rash. If all the clinical information can fit into a pattern, a specific list of differential diagnoses can be generated. Let's review our case from this morning. This is a patient with pale skin. As you can see, on the patient's low abdomen and flank, there are many whip-like, pink to erythematous linear plaques. The plaques are crossing each other and have minimal scales, no erosions, or any other epidermal changes. By looking at the rash, you can tell the pattern is very distinct. An experienced dermatologist will immediately classify the pattern of the rash as flagellate erythema. The differential diagnosis for flagellate erythema is fairly short. The inflammatory causes include dermatomyositis and adult-onset Still's disease. Iatrogenic causes include Shiitake mushroom dermatitis and certain chemomedication, including bleomycin, doxorubicin, and docetaxel. After having this differential, you can then ask the patient targeted question to make the right diagnosis. For example, you can ask the patient if they have fever, muscle weakness, joint pain, and any new medications. Without paying attention to the details of the rash, reaching the right diagnosis can be challenging. The right diagnosis for this picture is actually Shiitake mushroom dermatitis. It is a toxic reaction to lanthanum, a thermolabile polysaccharide that can activate interleukin-1 secretion, leading to vasodilation, hemorrhage, and rash. Symptoms typically occur 1 to 2 days after ingestion of raw or undercooked mushrooms. Blood tests may show leukocytosis and elevated CRP. Flagellate erythema is uncommon. However, this example demonstrates the importance of knowing the morphology of the rash and the fun of diagnosing with your visual skills in dermatology. Thank you for listening.